Okay, we're going to get started. I know we have some more people that should be joining, but we will, for the purpose of time, just go ahead and start recording. At the end, we'll open it up for questions. This is the beginning of our educational series about various topics that we specialize in at Thinifi. We focus on turnkey weight loss solutions, both internally and for other medical practices. We have both holistic and RX interventions that are available for various topics. The topic we'll be talking about this evening is fibroids, type 2 diabetes, and insulin resistance, and the link between the three of them. So we work not just with patients directly, but with other medical professionals to address the root cause of weight gain. We work on anything from hormonal imbalances to lifestyle factors that can cause people to gain weight and the inability to lose weight. Our goal is to empower patients to thrive through personalized support and innovative solutions, whether that's holistic or medical intervention that ultimately will bring lasting wellness to patients. Our topic today is fibroids. Fibroids are non-cancerous tumors that grow in and around the uterus, commonly affecting women of reproductive age. Size can range anywhere from pea-sized upwards of the size of a watermelon. Prevalence and risk factors will determine the location and the impact on the woman's health. About 20 to 80% of women will develop fibroids, and most of that is driven by race and some other factors we'll get into on the next slide. There's different types of fibroids. Some grow inside of the uterine wall, some are on the outside of the uterus or beneath the lining of the uterus, and some are attached by a little stalk, as you can see in the diagram to the right. They have a great visual of that. So there's different risk factors for women with fibroids. Obesity is one that can impact a woman's amount of fibroids, the impact on her livelihood, and how much they interfere with her daily activities. Hypertension, early menstruation. Women in their 30s and 40s are generally when they start to suffer the most from fibroids. We found that women that have a family history of fibroids are more prone to them as well. And African American and Hispanic women seem to have the highest percentage. African American, roughly 80%, will experience fibroids before the age of 50, and Hispanic women close to 60%. So let's talk about fibroids and weight gain. So there's a couple of reasons that women suffer from weight gain and the inability to lose weight as it pertains to their issues with fibroids. So the first is hormonal imbalance. Estrogen plays a key role in the fibroid growth that women see. Elevated estrogen levels will contribute to weight gain. Also, hormonal changes will cause things like fluid retention and an increased fat storage for women that suffer from fibroids. And of course, metabolic changes can also affect women. So some of the ways fibroids can impact a woman is they can cause insulin sensitivity, leading to type 2 diabetes. They can alter glucose processing and fat storage, which will also contribute to weight gain. So how does insulin resistance and weight gain come together? So higher blood sugar triggers increased insulin production. Excess insulin signals fat storage and hinders the ability to burn fat. And it also contributes to type 2 diabetes as fibroid symptoms worsen. Both fibroids and insulin resistance promote weight gain. Weight gain exacerbates the metabolic health issues and the fibroid symptoms. And it just creates this cycle for women that suffer that ultimately can find themselves desperate for solution. Nobody really talks about the link between fibroids and weight gain. So we're going to talk about some of the issues outside of generalized pain and anemia, which are obviously common side effects for women that suffer. So chronic low hemoglobin contributes to the development of type 2 diabetes by exacerbating insulin resistance, increasing inflammation, and impairing the body's ability to manage blood sugar effectively. The heavy menstrual bleeding often leads to anemia. So things like low hemoglobin will often signal anemia, which is common for people that have type 2 diabetes. Another issue that we see is kidney damage. So diabetic nephropathy, if I can speak, can reduce erythropoietin, I can't even pronounce that word, a hormone that helps produce red blood cells, leading to lower hemoglobin. So essentially, when women find themselves with heavy menstrual bleeding, they often have times not just regenerating the blood, but keeping their bodies regulated throughout the month. And this is where we see blood sugar spikes with between oxidative stress. So high blood sugar causes oxidative stress, damaging red blood cells and lowering hemoglobin levels. And chronic inflammation is also related to the inflammation that we see when these women are suffering from fibroids. So we wanted to discuss holistic and prescription treatment options that we have been using in our practice. We have a multi-pronged approach, whether there's holistic or RX intervention. Our first thing that we look at is diet and nutrition for women that are suffering from fibroids. We want to make sure they're focused on low glycemic foods, foods that don't spike their blood sugar, such as whole grains, leafy greens, and lean proteins. We also will put them on an anti-inflammatory diet, focusing on antioxidants like berries, fish, cruciferous vegetables, anything that really can ultimately reduce the inflammation that's associated with both fibroids and insulin resistance. And we focus on a fiber-rich diet as well. So fiber helps them regulate blood sugar, it helps support healthy digestion, and ultimately will help them manage weight and fibroids. We also encourage our patients to exercise regularly. It helps reduce insulin resistance and promotes healthy weight loss. So aerobic exercises like walking, cycling, and swimming improve insulin sensitivity, and strength training helps to build and maintain lean muscle mass and reduce fat, further improving their metabolism. We also help our patients focus on stress-reducing activities. High cortisol levels from stress lead to increased appetite. They promote belly fat storage, and they also reduce fat burning, ultimately leading to weight gain. Some of the things that we encourage our patients to do for stress-reducing activities would include yoga, meditation, and mindfulness. We have a supplement protocol and a detailed ebook available if you're interested at the end of the call that talks about how we tackle this in a holistic manner. So the first thing is we focus on helping patients with D3 deficiency. We see a common link with D3 deficiency with patients across the board, but especially those that suffer from fibroids. So we make sure they have a high dose of D3 supported, which will support their cardiovascular function, their mood, their stress levels, their bone and skin issues, and ultimately immunity. We also have a product that we call Proantho Forte, which acts as an anti-aging agent through its antioxidant effects. And then, of course, we have what we call our women's ultrabiotic, which supports a healthy vaginal microbiome, gut biome, bowel function, macro and micronutrient digestion, and immunity. We've also taken GLP-1s in a microdosing manner and found results to be quite successful. So there's two different approaches to our RX intervention that we do in-house. One is semaglutide. Semaglutide is a GLP-1 receptor that helps regulate appetite and blood sugar. It reduces insulin resistance and improves glucose metabolism. The benefits for fibroid-related weight gain, it promotes significant weight loss by reducing hunger and increasing satiety. It lowers blood sugar levels, aiding in insulin sensitivity, and it breaks the cycle of weight gain and poor metabolic health. Additional advantages, it will improve hormonal balance by reducing fat-related estrogen production, and it also helps patients manage type 2 diabetes. Tirzepatide is an alternative. Again, we microdose at our practice, so we don't go according to the standard dosing schedule. We also couple it with our holistic approaches previously mentioned. Tirzepatide is a dual receptor. It's a GIP and GLP-1 receptor, and it has enhanced glucose and weight regulation. It also improves insulin sensitivity and lowers blood sugar levels. It reduces the storage and promotes fat burning, and it supports a greater weight loss than semaglutide. So patients can lose an average of 30 to 40% of their body weight if combined with our full program, which would be one-on-one working with a dietitian, as well as making the lifestyle modifications that we previously mentioned. Together with these alternative approaches, we help improve metabolic health, address insulin resistance, and fibroid symptoms. This is an effective solution for patients with type 2 diabetes and fibroid-related weight gain, and it helps address the underlying condition, which ultimately is either insulin resistance or type 2 diabetes. So I will share my story. I was diagnosed with endometriosis at 23. I suffered from very heavy, painful periods. In about 5 years ago, I developed my first fibroid. During a routine checkup with my gynecologist, I was sent to the hospital because I had a substantial fibroid that was kind of blocking my cervix from moving. So my normal weight was 160. I was a size 4 to 6 and 5'10". I had put on over 100 pounds in a year with no change to my diet or exercise. I was exercising with a trainer multiple days a week. I was at a calorie deficit, and nothing that I did would allow me to respond to traditional methods that would help someone lose weight. I started off with undiagnosed insulin resistance and eventually was pushed into type 2 diabetes as my hemoglobin dropped month after month. So while I went into my hysterectomy, I had a hemoglobin in the 7s. I was hospitalized and put on blood transfusions and iron infusions weekly leading up to my hysterectomy. My post-op weight was 272. I was size 18. This is me on the left. This picture was taken January 3rd of last year. Picture on the right is me January 2nd of this year. My results after low dosing a GLP-1, which was tirzepatide, is a weight loss of 97 pounds. I am down to 184. I have had a total hysterectomy. We kept me at 2.5 for 70 pounds, and I lost 70 pounds for over 8 months. And I am been on 5 milligrams for the last 3 months, and I've lost an additional 24 pounds. I'm now back into a size 6, even though my weight is higher than my normal weight. All of my lab works are normal, and my A1C is no longer in a type 2 range. I'm going to pull up my before to show you the body recomposition that can happen. So here I am at the beginning of my journey. This is post-hysterectomy. You can see kind of my body here. This is our 3D scanner we have in office. It's a little distortion here. It's not a perfect thing. And then this is me just a couple of weeks ago. So here I am at 184, and my body has come back. I still obviously have some weight to lose, but over the year, I've lost at a steady pace of right around 1.5 pounds a week. Combined with diet and exercise, I was able to get back into the range that I was previously in. I'm going to open up the call to questions. Does anybody have any questions? I'm good. I'm just turning everyone's mics back on. Okay. Diane. I don't know how to unmute you, Diane. Do you have a question? Can you hear me, Diane? Okay. If nobody has any more questions, I'm happy to wrap the call. I hope this was informative. We have multiple topics coming up over the course of the next few weeks. This was our first one. We hope that you enjoyed it. We hope I know you had signed up for the next one. Please join us. We're hoping to have a bigger participation. If you have any questions, if you're a patient or you're a physician, we've sent this out to both. We'll be putting this up on our YouTube channel for people to listen to that weren't able to make it, that signed up. We're happy to reach out or schedule a one-on-one if you have additional questions. Our goal is to help bring safe and effective treatment to women and men. We have different areas of practice that we focus on, not just fibroids, PCOS, endometriosis, menopause, all stages of menopause, pre and post-operative care, getting people to a healthy BMI. We are not just a shop provider like a lot of the medical weight loss clinics. We are trying to keep people at low doses of medication and promote healthy healing, long-term healing. Oh, I see you have a question. Let's see. Go ahead if you want to unmute. I don't know how to unmute you. Let's see. If you want to unmute yourself, you can certainly ask a question. I just don't know how to unmute you on my end. Hi, Tara. We just finished. But if you have any questions, feel free to answer any questions or ask any questions. I'll be happy to answer. Okay. Well, if you guys want to send me an email, my email is Christina@Thinifi. Certainly reach out. We're happy to answer any questions. You can call us direct. Our number is right here. I will put that up on the next slide. I blocked off a lot more time because I thought we'd have Q&A. We had a lot more people sign up than this. But here's our phone number, 888-742-3775. Our website is thinifi.com. Happy to answer any questions. Hope that you guys can make the next seminar of ours. And like I said, we'll be putting this deck up on YouTube. Oh, I see. Sorry, is the presentation. Yes, Tara, I will be, if you want, you can give me your email. You can email it to me at Christina@Thinifi.com. I will forward the presentation to you. We went through it so quickly that I could go over it again if you'd like. I could maybe redo it one more time. Let's see. Are you guys able to unmute yourself on your end?